All right, so I'll be doing lateral palpations. I'm gonna begin by finding the iliac crest. From there, I'm going to go down to the TFL, the glute medius, we have the greater trochanter, and then you also have the IT band, which runs down as well. All right, so now I'll be doing the Ober's test. This is gonna be testing for IT band tightness. So to do this test, I'm gonna just have my patient relax sideline. I'm gonna come and clear the greater trochanter, and then I'm gonna slowly release the leg. And a positive sign would be if their leg was like sticking straight up, so there's flexibility in the IT band, so it's not tight. All right, so now I'll be doing SI joint compression and distraction. This is testing for SI joint dysfunction within the sacrum. So to begin in the SI joint distraction, I'm going to be pushing at the hips together, trying to distract the posterior aspect. And then compression is going to be opposite, where I'm compressing the SI joints together. And a positive indication of this test would be a reproduction of the signs and symptoms or pain they've been having. All right, so this test is the slump test. This is going to be testing for neurological entrapments or impingements in the spinal column, especially like the sciatic nerve. So to begin, the patient will be short sitting. I'm just going to have you just go ahead, like slouch, just like you would. All right, and from here, I'm gonna have you bring your head, your chin down, all right? And from here, I'm gonna be asking, do you have any signs and symptoms of pain, any numbness and tingling shooting down the legs?
No.
No, okay. So from there, I'm gonna provide overpressure, and then I'm gonna have you extend whatever the affected side is. And from here, still asking, do you feel any pain?
Mm-hmm.
Okay, then you're gonna bring your foot to you, dorsiflex, and this should cause that tight, positive indication. So you can relax on any point throughout this test that they have any numbness, tingling, or pain. You're gonna go ahead and just stop. You don't have to go all the way through it. So this is the hip scouring test. This is testing for possible labral tears. To begin, I'll bring the patient into hip flexion. I'm gonna be applying pressure and then going into internal and external rotation throughout, looking for pain or discomfort, any sharp shooting pain, and a positive test would indicate a possible hip labral tear. All right, so this is the Koenig's test. This is going to be testing for a possible nerve root impingement or entrapment within the spinal column. So again, the patient's going to be supine. I'm going to start by passively flexing the hip. I'm going to go until the patient says that they have the reproduction of pain that they've been feeling. So here, so is this where the pain has been?
Yeah.
All right. So from this point, you're going to stop, and then you're going to bring them into knee flexion, and this should subside the pain. So all signs and symptoms should have diminished by now. Yeah. All right, and then you return. All right, so this last test is just gonna be assessing the tibial torsion, so their overall tibial torsion angle. So the patient's gonna be prone. I'm gonna have them come in the knee flexion and just hold for me. So to get a good measurement, you can use pencils, straws, whatever. So you're gonna put one between the medial and lateral malleolus. And then the next one, you're just gonna follow right up the tibia along with it and have them cross it over. So then you're going to take a goniometer and you're going to measure the angle that you have, and that's your overall tibial torsion angle. This, where you can see right now, indicates what the angle that they have, that they are externally rotated or have an external tibial rotation.